think you're having a heart attack. Maybe you think somebody else is having a heart attack. I'm going to look at heart attacks today for the simple reason it could happen to anybody at any time. And just having that bit of knowledge what to do can make a massive difference to somebody, whether it's your life or to somebody else's or to a stranger. Now, I'm sure you don't really want to put any pressure onto emergency services, but this is not something that you are going to gamble with. So let's look a little bit closer then. Signs and symptoms. What is a sign? It's something that you see. A symptom is a feeling though. The obvious sign that people think of when people say a heart attack, they think holding the chest, the dreaded chest pain. Now this might be the case, but not everybody has that dreaded chest pain right in the center. It could just be a different feeling, or it could be a crushing feeling, a vice-like grip in the chest. Now that pain can radiate. It could radiate up to the jaw, down into the stomach, and yes, into the arms. This pain does not ease. The person, or even yourself, might feel nauseous or vomiting, actually vomiting. Maybe you think it's digestion. Maybe you think that, you've eaten something too spicy. This is not something that we are going to play with. Clammy skin, wet, heart rate, maybe going faster and faster. You feel as if you're struggling to breathe. What are you going to do? Or what are you going to do for that person? The first thing we want to do is, if you suspect a heart attack, you must call 999. Please, please do not leave it till the next morning or the next day. Get it dealt with now. Every 3 minutes, somebody has a heart attack in the UK. Every 3 minutes. Let's get it checked out before you become a statistic. So what are we going to do to help that person? We want to get them low onto the ground for the simple reason that if they were to collapse, they don't have as far to fall. Ideally, get them into what we call the W position. So sit them down, something supporting their back, of course, yeah. Put something under their legs as well. The reason why we say the W position is because it relieves the pressure on the heart. It doesn't have to do too much hard work to keep pumping blood around the body. So W position, or the lazy W, you might hear it being called. We've got 999 on the way. And this, I strongly advise you. Now, there are other brands, but this just happened to be the one I picked up. This is aspirin. Yeah, aspirin. Next time you're in your supermarket doing your shopping, pick up a box. But please make sure it's the 300 milligram of aspirin. Why? Why is this something that we would give? So a heart attack is when there's a clot on the way to the heart. And with aspirin, yes, it's a blood thinner, but if I put it into another way, it basically takes away the superglue out of the blood, meaning that it's actually stopping the blood from sticking to that clot. And also it can be breaking down the clot that's already there. So aspirin, definitely. Make sure you put this inside your supermarket trolley the next time you're out, 300 milligrams. It's really important before you give somebody this aspirin that you ask them, one, are they allergic to it? If they are, do not give it to them. And number two, ensure that they are over the age of 16. Now, how are we going to give it to them? You might say, okay, here's one, and give them some water to swallow it. We don't want them drinking any water. There's two reasons why. The first reason is we want them to get that aspirin and we want to put them into the mouth and we want them to chew it. The reason why it doesn't taste nice, but the reason why we want them to chew the aspirin is because it dissolves through the gum line and the lining of the mouth quicker, and it gets into the bloodstream and starts working quicker. You're talking about 5 to 6 minutes by just chewing it, going through the gums and lining the mouth. If you were to give them water to swallow it, you're looking about 20-25 minutes before it gets into the bloodstream. This is why we want them to chew it. Start working quicker. We also don't want to give them anything to drink for the simple reason, what if it is a heart attack? And if you've just given them lots of water to drink, then you might be delaying surgery if required. Okay, so let's just have a little recap. Heart attack. Remember, every 3 minutes, someone in the UK suffers a heart attack. So we want to get them sitting down, ideally. Remember that W position. Put something under their legs just to make them comfortable. We want to make sure that we've got the 999 called and give them aspirin. Dosage, 300 milligrams. It is important that you give them this dose. Get them to chew it so it goes through the lining of the mouth. Remember, we don't want to give them water to drink for those 2 reasons. 1, it goes into the bloodstream even slower, and also there may be a potential for surgery, and this can cause further injury or harm to the person if they've drank a lot of fluid. All right. Recap of the signs and symptoms. Yes, it might be that classic pain in the chest right here, that vice-like grip, but it might not be. It could just be a feeling of difference here. The pain is what we call radiating, can go up into their neck, their jaw, could go down into their stomach, down their arms. They might feel nauseous, start to vomit, sweaty, clammy skin, feeling dizzy. Please make sure you get help straight away. Not tomorrow. Don't sleep on it. Get it checked out now. I'm Sarah, and I am owner, trainer of First Aid at Work, Aberdeen and Aberdeenshire, in partnership with Mini First Aid Aberdeen. Now, if you want to get yourself booked onto a course with me, making training fun, engaging, and most importantly, memorable, I have got open classes, or if you want me to come to your place of work, then please do not hesitate to get in touch. And I look forward to seeing you on one of my courses, or next week when I'm on screen. Keep safe, everybody, and have a fantastic weekend.